Hi all. Now we are going to discuss about collection and transport of specimens. For any disease diagnosis, the first important step is the collection of the exact sample and transportation of the same sample to the laboratory as soon as possible. So actually what is specimen collection? Specimen collection means it is a process of obtaining any tissue or body fluids like blood samples for the laboratory analysis or near patient testing. It is often a first step in determining any diagnosis and treatment for whatever may be the disease. We have to be very careful about the collection and transport of specimen. In general, diseases can be classified into infectious and non-infectious diseases. So, for infectious diseases, the specimen collection is much important step because sometimes the specimen collection step itself may introduce any contaminant into the patient's sample, because any laboratory which generates the results is limited by the quality of the specimen and its condition on arrival to the laboratory. Specimens should be obtained to minimize the possibility of introducing contaminating microorganisms that are not involved in the infectious process, and this is one of the important steps in diagnosis of any disease. As this is one of the rate limiting step in disease diagnosis, there are certain guidelines to be followed while collecting the specimen. The first thing is we have to be very careful about the type of infection, because we have to collect the sample depending on the type of infection. So the person should be aware of the type of infection. And the next thing is aseptic precautions. As we are going to collect samples for the infectious diseases, we have to be very careful to follow the aseptic precautions. And next one is the anatomic sites and locations that has to be chosen depending on the type of infection. And then next important thing, that is the adequate amount or volume of the sample. The laboratory technician should aware of the test to be done. So they should clearly take the adequate amount of the sample required for the further analysis. Next thing is tissue or other body fluids. So the laboratory technician should know whether they have to take any tissue or other body fluids like blood or upper respiratory tract fluid, or like CSF, that is cerebrospinal fluids. And another important thing is the proper timing. So there is important thing while collecting the sample, that is the timing. Just for example, for filarial infection, that microfilaria which causes that lymphatic filariasis circulate in the blood at night because it is having nocturnal periodicity. So for this type of infection, blood collection should be done at night, so that it has to coincide with the appearance of the microfilaria, so that we can easily observe it while staining. So the proper timing has to be maintained. And then the next important thing is the clinical laboratory form. You know well, in microbiology, labeling is one of the important steps before any process. So in this specimen collection also, the sample request form is much important, which contains the information about the patient, like their name, date of specimen collection, age, sex, time of sample collection, whether the patient is inpatient or outpatient, and the ward number of the patient, then the nature of the specimen that has to be collected, either it may be tissue or body fluids, and then what are all the investigations that has to be done with the samples. And the next thing is whether the investigation is urgent or routine. So these things should be mentioned in an ideal sample request form. For some specimen collection, we have to use the transport media. For example, for viral infections, we have to keep the sample in transport media, and then it has to be transported to the laboratory until the process has been made. The next thing is we have to be very careful while handling the sample and we have to label the things, and we have to be very careful while transporting the samples also. And another important thing is use of appropriate container. So we have to use a specific container for the specific samples. For example, for blood we have to use that particular blood containers like vacuum or some type of containers, and for urine samples we have to collect the urine sample at urine containers, and for fecal sample again we have to go for that particular fecal containers. And the next important thing is the patient has to be given particular instruction either by the doctors or by the laboratory technicians. And another important thing is the administration of antibiotics were not allowed before the test, as it may influence the results. And another thing is we have to avoid any contamination while collecting the specimen. Transport is also considered to be equally important to that of collection of the specimen. So the samples has to be transported to the laboratory within 2 hours, and then the containers which contain the particular specimen should be leak proof, and there should be separate section for the paperwork in the specimen containers. And for particular samples there should be special preservatives, or for some samples there should be some holding media. For example, for virus I have told about viral transportation media. And more importantly, we have to paste the biohazard label in all the sample containers, as it contain infectious material. Here in this picture you can see the triple packaging system that has to be followed for specimen transportation. So here you can see that the test tube which is in the center, that is the primary receptacle, and then the test tube has to be covered by absorbent material, and then it has to be kept in a container which has a tight cap, that should be watertight, and then the container should be kept in a outer packaging, that is the carton box, and the secondary packaging should contain the specimen record, which includes the contents inside the tube. So these are all the things that should be followed while packing a specimen. There are certain criteria for specimen collection, like that there are certain criteria for rejection of specimens also. So when the specimens has to be rejected means if the processing of a specimen may not be done in the laboratory, so that such a decision must be made in light of the specific requested investigation. Otherwise the laboratory investigations of a sample are waste of time and resources. If these criteria are not followed, it is actually total waste of time. The first thing is, if the samples may miss or inadequate identification. That means if the sample doesn't have any identification criteria, that is if the sample lack any labeling, and then if the sample is in insufficient quantity. If we have to do so many tests, if the sample is insufficient, means that is actually waste. And the next one is the specimen collected in an inappropriate container. For example, if we are going for any microbiological analysis, means the sample should be collected in a sterile container. If the container is not a sterile one, then it is a mere waste. And if any contamination suspected, so that sample has to be rejected. And another thing is if it is stored inappropriately, or if it is transported inappropriately without any triple packaging system, we can reject those specimens. As I said, the specimen has to be collected in appropriate containers. So here we can see some of the containers and swabs for collection of particular specimen. For fecal sample, the universal container has to be used. That means the container contain a spoon which is attached to inside of the screw cap. And for urine, universal container has to be used for small quantities of urine, and for larger quantities like 250 ml or more. So there is a container which is a wide mouthed screw capped bottles, which is much convenient. And for sputum samples, here universal container should not be used. The container should be square, wide mouth, disposable one. And for blood, sometimes the blood has to be collected in a container with anticoagulant or without anticoagulant. For serological examination, the anticoagulant is not needed, and for parasitological examination, so we have to collect the sample with anticoagulant like EDTA. And here you can see the blood culture bottle in the image. For some type of infection, we can directly culture the blood in that particular medium. So this must be at least large enough to hold 50 ml of the liquid medium, with which it is issued from the laboratory, plus 5 to 10 ml of patient. And for serous fluids, we can use the universal container, and before that we have to add 0.3 ml of 20% sodium citrate solution to the container before autoclaving, so that it can avoid difficulty in performing cell counts or centrifuging procedure with such. And the next thing is swabs. So swabs, I think you have seen swabs during the COVID testing. So swabs are suitable for taking specimens of exudates, especially from throat, nostril, ear, skin, wounds and other accessible lesions, which consists of a sterile pledget of absorbent material. I think you have seen swabs in your antimicrobial sensitivity testing itself. So here I have listed some of the swabs which has been used for special purpose. The first one is baby swabs, and another one is pernasal swabs, and next is post-nasal swabs, laryngeal swabs, high vaginal and cervical swabs, and finally serum coated cotton wool swab. And these swabs are used for particular type of and finally the containers which are used for anaerobic specimens. So as a part of specimen collection, in some type of infection we will be collecting some anaerobic specimens. So for that type of anaerobic specimen collection, generally we need syringe and needle for aspiration, and apart from that we also need a tube or vial which contains a semi-solid holding medium with an atmosphere of 5% carbon dioxide, as it may maintain the anaerobic condition in the sample containers. Here this CO2 is a reducing agent, the tube used for putting up the swab. And then the next one is the ready-made swabs in a plastic tube or a jacket, and it contains either the carry blair, amines transporter pre-reduced medium. And another type of anaerobic specimen container is plastic pouch or bio bag, which contains a CO2 generating system, a palladium catalyst and an anaerobic indicator. So these are all some of specimen collection containers. So we can see rest of the things in next part. Thank you.